We are now joined by Michellene Davis, Executive Vice President, Chief Corporate Affairs Officer, RWJBarnabas Health. How you doing, Michellene?
I am well, my friend. It's good to see you.
Good to see you. Listen, we've talked about so many different aspects of healthcare, but this a little bit different because there's a new publication that's out as we're doing this program at the end of October. It'll be seen after. Changing Missions, Changing Lives, how a change agent can turn the ship and create impact. What's it all about? You co-authored this with Barry Ostrowski, who leads RWJBarnabas Health.
Absolutely. My president and CEO, we wrote it together. Steve, thank you so much for asking the question. It is always an honor to be here. It is really about providing a pathway, a blueprint for change agents in other organizations to best understand really what our journey has been like to date. Back in 2016, the corporate board of RWJBarnabas Health was good enough to acquiesce to us launching into an initiative that was more than just nonprofit healthcare system community benefit. Rather, we wanted to make certain that we went way upstream in order to affect the systems and the structures which really create the structural inequities within communities that make them ill, right? That keep communities from being healthy and strong. Our entire framework for social impact and community investment is a policy-led health equity framework, right? It means that we address something called the social determinants of health, those factors outside of your clinical setting that most affect and impact your health outcomes through an equity lens, right?
Go back, Michellene, sorry for interrupting. Let's remind folks of some of the social determinants of health. Go ahead.
Absolutely. So social determinants of health are food insecurity, whether or not you have access to fresh, nutritious, affordable, organic food. Another one is transportation. Lots of individuals lack easy, accessible, affordable transportation to get back and forth to both work as well as to a doctor's visit. The next is actually also economic factors. So that includes, quite frankly, work, as I just described, right? Are you, in fact, in a job which actually earns upwards towards a livable wage? Right? Or are you a part of the ALICE population, asset limited, income constrained, but employed? Are you a member of the working poor community, right? Another is housing, right? It's incredibly important that you live in safe, healthy, affordable housing, right? So our stats in this state, the 14th wealthiest state in the country, indicate actually that there's a great majority of individuals who are actually house burdened, right? They pay over 30% of their income towards living. Right? And so as a result of this, we want to make certain that we are not just saying, here, come to our hospital so that we can take care of you, but we're also going out into the communities in order to really work with community members to co-design what they feel that they need and data proves that they require in order so that everyone can grow up healthy and strong. Not just some, not just those who can afford it, right. Not just some who look a certain way or come from a particularly educated background, but everyone.
You know, Michellene, this book, you know, it is a blueprint, but it's also a challenge. Is it, in fact, as I interpret it, and by the way, Michellene Davis is a board member, a board of trustee member of the Caucus Educational Corporation, RWJBarnabas Health, a significant underwriter of our work. This appears to be a challenge to other organizations to go outside the paradigm, outside the lanes, if you will, of what their blocking and tackling is supposed to be and saying, wait a minute, what is your larger social responsibility, particularly in these challenging times with the racial and structural inequities that have been going on forever, mean to people who are suffering and struggling? A long-winded question, I know, is it a challenge?
Absolutely. Listen, it's a charge. It's a call to order. This is what we've decided is going to be our pathway. What is going to be yours? It's no longer can you just merely cut a check to a something, but quite frankly, when are you going to come out of your ivory tower to cherish the lived experience of those in the communities that we claim we want to help and aid and assist, realize that these communities are asset packed, right? They are not just poverty stricken or disenfranchised or marginalized. They are asset packed with individuals who have lived experience and have weathered, right, all of that marginalization and disenfranchisement and under-resourcing, but that all of those things has happened for as a result of something, right? No one wakes up early in the morning and says, yes, good morning, I want to be the one born into poverty, right? That's not how it works, Steve. And so we've got to be able to go further into this space in order to charge others to come forward to do this, because quite frankly, as we look at it through a lens of health equity and the quest to eliminate, not just reduce, health care disparities, what we acknowledge is two things. One, we can't do it on our own. And two, no one can do it sitting in an ivory tower, right? So we've got to make certain that we're going way upstream to change the system and the structure that impacted the area that we seek to make better now.
You know, this book, Changing Missions, Changing Lives, written over a period of time, co-authored by you and Barry Ostrowski. To what degree do you take COVID into account in this book?
So it's really interesting that you say that. This was certainly written and before COVID
That's why I'm
onset.
saying it.
Absolutely. But again, right, the entire book is about dealing with change. The entire book is about how we need to ensure that we are nimble in our mindset and reflective of what is going on around us. The fact that just because you have a protocol, a policy, a practice in place, that if in fact it is not cognizant of everything around it, right, then it is immediately stagnant and stale, and you've got to pivot. Right? So truth be told, I actually think that the book could be a very positive tool because it's two leaders. Now hear this, Steve, right? It's not to just presidents and CEOs. It's not just to executive vice presidents. It's to those who feel the call to leadership at any rung of the ladder throughout their organizations of any size.
My book, Lessons in Leadership, that you know very well, the follow-up, written 5 years ago, the follow-up to it is a book that Mary Gamba and I are going to be writing in the next 6 months, called Lessons in Leadership, Innovation and Disruption in the Age of COVID and Beyond. Now, why do I mention it? Because it strikes me that this initiative that you're talking about, this commitment that you and Barry and your colleagues are involved in, is a great example of innovation. Because the healthcare, taking care of people when they come to the hospital, that's what you do. Innovation is social impact, examining social determinants of health. I'm not saying you're the only ones doing it, but you are leading the way. I don't want to make this into a commercial, but is this a classic example of innovative leadership?
Steve, first of all, thank you. Yes, I'm okay with the commercial. Here's the rub, right? So the difference about our work is that it is policy-led through an equity framework. I am fully convinced that you cannot address the social determinants of health if, in fact, you do not apply a racial equity lens. If, in fact, you do not study why it is that these things exist, and I'm not talking about behavioral modifications, I'm talking about go all the way back to the 1934 Fair Housing Act. Understand about the fact that redlining is real. Go back and view the congressional record.
Right now, say redlining. What is Michellene?
Oh my goodness!
Google redlining and what banks and what government policy did to decide who would live where and who couldn't live there. Go ahead. I'm sorry, Michellene.
Well, Google, in addition to that, predatory lending practices and disenfranchised communities, right, really understand that this was banks and government together, right? Understand that so much of the history of how certain laws and policies came about were really conditioned on ensuring that certain groups were kept out, right? Go back and look at land grants and how they even got passed. Right? So you can't address these issues unless you look through that lens. And that is what is unique about the way in which we do our work.
The book, Changing Missions, Changing Lives, the co-authors, Michellene Davis and Barry Ostrowski. Michellene, thank you, my friend.
Thank you.
Be well. I'm Steve Adubato. Thanks for joining us. We'll see you next time.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Reimagine Childcare, PNC, Grow Up Great, New Jersey Sharing Network, Seton Hall University, Valley Bank, the Robert Wood Johnson Foundation, Johnson & Johnson, United Airlines, and by ADP. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network, and by Jaffe Communications.
This is the Seton Hall story, one that comes to life every day on our campus. This is the place where great minds discover, innovate, collaborate, and find their true calling. This is the place where passion has a purpose, where learning inspires leading. The bonds we make, the values we teach, inspire our community to take heart and take action. This is Seton Hall University. This is what great minds can do.